In part 5 of the lecture, we will see the spread and effects of neoplasia. These are the possible effects of a tumor. You can see this is the colon. This is the lumen of the colon where the feces go pass through. And this is the wall of the colon. And you can see there is a tumor here. And if the tumor is very big, it can cause obstruction of the lumen. So it can cause obstruction of the feces. The patient will present with constipation. The tumor can also invade into the surrounding tissue. It can invade through the colonic wall into the other parts of the body. So it can go through into the bladder, in the uterus in females, in the reproductive organs. It can cause ulceration where there is loss of the epithelium in the tumor. It can destroy the adjacent organ when it invades through to the organ. It can cause hemorrhage when it has invaded into blood vessels. It can cause infection when there is obstruction of the lumen. In this case, there is backflow of feces, and that can be a source of infection. And a tumor, a malignant tumor, can metastasize to other parts of the body. This is a picture of lymph node of the same case just now. So these are the lymph nodes that has been metastasized by the cancer cells. So you can see that the lymph nodes are large. So this is stage C, Duke's C. The same cancer, the colorectal cancer just now, has also metastasized to the liver. And this is the normal liver tissue, and you can see that there is an abnormal growth here, and under the microscope it will confirm that this is the metastasis from the colon. There are also metabolic effects of a tumor. A tumor may retain the functional property of the primary organ, especially well-differentiated endocrine neoplasm that can secrete the hormones that the organ of origin usually secrete. It can also cause non-specific effects such as cachexia that is usually manifested by anorexia, muscle wasting, loss of subcutaneous fat, and this is due to the production of tumor necrosis factor alpha or TNF alpha, also called cachectin. TNF alpha suppress appetite and stimulate cell apoptosis that causes the muscle wasting and the loss of subcutaneous fat. Non-specific effects of tumors can also present as anemia or chronic disease or iron deficiency anemia. It can also cause hemostasis abnormalities such as increased risk for thrombosis, fever due to infection, and paraneoplastic syndrome in 10% of cases. A term that you might come across when you look into neoplasm is paraneoplastic syndrome. These are the signs or symptoms in patients with neoplasm that cannot be explained either by the local or distant spread of the neoplasm or by the production of hormone that are indigenous to the tissue which the neoplasm arose. The paraneoplastic syndrome may involve endocrinopathies, and abnormalities of the endocrine or hormone production, nervous system, dermatological or from the skin, musculoskeletal, and vascular systems. Paraneoplastic syndrome may be the early presentation of a neoplasm. It may be lethal and may mimic metastasis. Examples of paraneoplastic syndromes include Cushing syndrome in carcinoma of the lung, Remember, the lung don't usually produce hormones, yeah? And cortisol that causes Cushing syndrome is usually produced by the adrenal cortex. Yeah, but when we have cancer of the lung, the lung tissue suddenly develop the ability to produce a hormone that can stimulate the adrenal cortex to produce cortisol, hence producing a Cushing syndrome. It can be also polycythemia in carcinoma of the stomach, venous blood clots in carcinoma of the pancreas, and finger clubbing in carcinoma of the lung. This picture shows finger clubbing, whereby the tips of the fingers enlarge and the nails curve around the fingertips. This usually happens over the course of years, and nail clubbing is sometimes the result of low oxygen in the blood and could be a sign of various types of lung disease, including lung cancer. A very important concept in neoplasm, especially the malignant neoplasm, is grading and staging. And this is important because it has to do with prognosis or outcome of the cancer. Grading is based on the degree of differentiation, the architecture, and the mitosis of the neoplasm. And this is done microscopically. So it can be categorized as well differentiated, moderately differentiated, poorly differentiated tumor, and is based on the degree of differentiation. It can also be categorized as low grade and high grade. The importance of grading is well differentiated cancers or low grade cancers tend to be less aggressive and have a better prognosis than the high grade cancers. Poorly differentiated cancers or high-grade cancers tend to be more aggressive and have a worse prognosis than the lower-grade cancers. The most important prognostic factor for the cancer is the staging of the cancer. Staging of the cancer refers to the extent of the cancer, such as the size of the tumor, and if it has spread to the lymph nodes or if it has spread to a distant organ. Yeah, so size, nodal involvement, and distant metastasis. Staging is done by clinical examination, radiological investigation, and pathological investigation. There are many staging systems. Some, such as the TNM staging system, T stands for tumor, N node, and M metastasis, and these are used for many types of cancer. Why are cancers staged? The stage of the cancer suggests the most likely outcome. Knowing the stage gives an educated estimate of life expectancy and the chance of a cure for the patient. The treatment will be planned and recommended based on the stage of the cancer. For example, a surgery is almost always part of the treatment for earlier stage cancers, but it's usually not always recommended or possible for advanced or stage 4 cancers. Other therapies, including chemotherapy, radiation therapy, or immunotherapy, are also suggested based on the stage as well as characteristics of the cancer. Clinical trials that are available to test and understand new drugs or management strategies are designed to be available only to patients with a specific cancer at a specific stage. So it would not be helpful as part of a trial to test new drugs on people with stage 1 as well as stage 4 cancers. The goals and science of the stage of the cancers are different. This is the principle of the TNM staging. T stands for the primary tumor, and the higher the number after T, the larger the tumor or the more it has grown into the nearby tissues. N stands for the regional lymph nodes. The higher the number after the N, the more lymph nodes that contain cancer. M stands for distant metastasis, whether it's present or not. This is a picture of adenocarcinoma. So you can see the glands formation. You can see the gland is lined by the epithelium with a central lumen. There's a lumen there. So you can see again the adenocarcinoma with the gland formation. So this is a well differentiated adenocarcinoma. So this is grading a low grade or a well differentiated adenocarcinoma. So we mentioned just now the TNM staging. So in colonic carcinoma, they sometimes use the Duke's staging. In some countries, they use TNM, and some countries they use Duke's staging. So it depends on what the surgeon and what the pathologist is familiar with or comfortable with. So you can see the metastatic cancer inside the lymph nodes. So this is Duke's D staging. So the cancer, the colorectal cancer, has metastasized to the liver. So in the TNM, it will be M1.